Hello everyone, it's Dr. Bob Browner, recording community update number 8. These seems to be going well, and I've given this presentation 3 times yesterday, so I think we kind of worked through any bugs. So topics today are explaining the numbers and should I wear a mask or shelter in place. So first the numbers. Some of you probably heard now numbers nationally ranging from 100,000 dead Americans to 2 million dead Americans, which sounds like a very, very wide range. And the reason it's such a wide range is it's partly dependent on a couple things. One is how will the virus act, and this is a new virus, so we're not 100% sure how it's going to act. Second, it depends on how our government makes good or bad decisions over the coming months. And third, and most importantly, it relies on our populace to make the right decisions and listen and follow directions, and who knows how well that we'll do with that. So if we're good and we do our physical distancing correctly and our infection rates stay low and we don't exceed our health system's capacity, we could have only, say, 400 deaths in Nebraska and under 100 in Lincoln. So this requires us to do everything right, however. If we don't do everything right and it spreads through our community but doesn't overwhelm our hospitals, we could be talking about 600 deaths in Lincoln and up to 4,000 in the state. This speed of spread assumes that we do not exceed our capacity of ventilators in the state. The other problem, though, is if it spreads too fast or if it's a little more contagious and we start overwhelming our healthcare system, then the deaths in Nebraska start going from the thousands to the tens of thousands. And so this could happen. We do not want to be another northern Italy or a New York. We want to be where we are hopefully right now and stay that way, but that requires us to keep following the directions and doing our part. So visually, again, what this looks like is this is our hospital capacity. You exceed this capacity. Not only do you have deaths from coronavirus, you have deaths from everything else because people who have a heart attack or a stroke or a preterm delivery or appendicitis might not get care because everything's full. We do not want to be in this situation. We also don't want to be in this situation. We want to be down here. So the flattening of the curve and slowing it down is essential right now. This is why we are all in a place where we're mostly staying at home and social distancing. Um, a couple people have argued, and I've used this slide a couple times to say this is why you do not just let it rip. And so this is the life expectancy of England. The reason I pick England is because England was pursuing a strategy of, well, just let it go through the population and get it over with. The problem is that they ran the numbers and realized how many dead people that would be, and so they changed their path, hopefully not too late. So for comparison, for most of our history, the life expectancy wasn't that great for a lot of different reasons. It started going up because of clean water, sanitation, and vaccination. Then we had World War One, and you'll see this is World War One to this area, but there's another dip actually, and this is actually the influenza epidemic of 1917-18, which was worse than actually World War One and much worse than World War Two. So letting it rip and not doing what we should be doing it would be equivalent to having 4 to 5 times as many dead people as World War Two for our country. We don't want that. I hope none of you are for that. So the good news is that we are, I think, slowing things pretty well down in Nebraska. The problem we have in Nebraska is we're still slow on testing. It's still taking up to a week to get, or 10 days to get test results back. There's still restrictive testing, so it's not widespread. And so we are getting some data. The good news is the percentage positive is relatively low, meaning these are high-risk people, but still 94% of them are negative. So good news is that our positivity rate is relatively low. We're still woefully incomplete. My guess is there's probably the true number of infected people in Nebraska is probably in the 500 to 1500 range. We have a lag in testing. And because of that lag in testing, we won't know where we are for a while. It isn't all the way across Nebraska, but you can see that it's in Kimball County, North Platte, all over the state. So it is everywhere, so we all need to be paying attention to this. So the next question though is when can we open up again? And so we are right now, U.S. and France, for example, are in the exponential growth phase. It's going to keep going up, and we don't know how far. Luckily, Italy may have peaked, hopefully, but you're going to need to see a decline for a while because you could see a false decrease and go back up again because people didn't stick through long enough. Hopefully, Spain may be flattening out as well because these countries both have over 10,000 deaths already. So we, to open up again, are going to need to have data like this, which we're weeks away from having data like this. There is a roadmap to reopening, which I think is very well written by Scott Gottlieb and his partners. They're former administration officials from several administrations, plus experts from Johns Hopkins. There basically is when can we reopen? We're in phase one where everything is shutting down. To open back up again, we need to do a couple things. One, our state has to be able to test all people with symptoms, and we're not there yet. My guess is 1 to 2 weeks. Once we can test everybody, then we have to see a sustained reduction for 14 days. The reason 14 days is because that's how long the virus lasts. So we need to make sure that we've burned through whatever cases there are before we can talk about opening. Then we have to make sure the hospitals are restocked. Do they have enough protective equipment? Do they have adequate ventilators? Because if we open up too soon and we make it bad, we don't do it right, and we have a surge of cases, we need to be ready. A hospital needs to be stocked just like you wouldn't want to go to battle with no ammunition. Our hospitals need to be restocked. The other thing is our state and our community has to have an active monitoring plan, which I do not think is up and running yet. This is going to require not just the health department, but the health department working with their primary care doctors, which hasn't happened yet. So I think that needs to be in place before we open it up as well. What it will look like, this is from Tom Frieden, our former CDC director. We'll have our big peak. Hopefully we won't have a big peak in Nebraska if we caught it in time. Then we may be able to gradually start opening things up, and it'll be staged. It won't be all at once. And we have to be ready, potentially ready to close at a moment's notice. And what people are finally getting to realize and understanding now, because we may not have a vaccine for 12 to 18 months, we could be doing this pattern for the next 9 to 18 months potentially. And so people need to be honest and start thinking about the long term now. So to get ready for this, we should be doing planning now. So hopefully the next stage in our community is to get the health department, primary care networks together to start planning how we're going to do this in 4 to 6 weeks. What we don't want to do is be Philadelphia's. Unfortunately, we're finding this is the map of the epidemic 100 years ago. Some communities did it wrong, some did it right. We're finding out who did it wrong, and it sounds like New York, probably Miami, New Orleans didn't close down fast enough. I think New Orleans still had some Mardi Gras celebrations. Miami still had spring break. They may be headed toward this. Hopefully we'll be more like this. St. Louis has often been touted as a city that did it right initially, but unfortunately opened up too soon and had a worse peak like that. Omaha did the same thing actually 100 years ago. We want to be more like Minneapolis 100 years ago. So hopefully Nebraska will be that way. So to get there again, we need to have these centralized testing facilities up and running like Germany and South Korea have. I hope we're within 1 to 2 weeks of this. Because to do that, to do this planning and monitoring, we have to have that in place so that we can shut at a moment's notice if need be. Again, if you haven't watched, there's a plan on stopping pandemics. This from Larry Brilliant from 14 years ago. So please take the time to watch his TED Talk. Last is what can you do individually? So a lot of people my generation go up with Smokey the Bear campaigns, which is actually a lot of light. Only you can do it, and here's the little simple directions you're supposed to follow. So only we can prevent coronavirus spread. So we need to do some things. We need to get past our denial. I think we're all past denial finally. There's still a little fear happening, and people, I think, but hopefully people are past the toilet hoarding and N95 mask hoarding and buying ammo fear things. Still a little bargaining. Can I have 2 weeks? How about 4 weeks? No, 6? No, we need to be acceptance and start thinking through this logically. So, big question is, should I wear a mask? And this from a couple days ago in the New England Journal is that people I think are a little over obsessing about the type of mask. The mask that a healthcare provider uses like an N95 mask. That's because I'm in a patient room with somebody coughing up COVID. That's where the N95 is needed. And that's in a confined area. The chance of catching COVID-19 from a passing interaction in public space is minimal. So as long as you're maintaining your space, you're probably fine. The big issue is actually not the mask, it's contaminating your hands. And so I think people are spending too much time on the mask and not enough time on making sure they're not making sure that they're washing their hands. It's when you touch stuff that you're going to be getting it. The mask issue, I think people are getting backwards. The reason to wear a mask is not because you're protecting yourself from airborne droplets. The reason you wear a mask is two. One, it keeps your hands from touching your face. They keep saying don't touch your face. Good luck with that. As soon as you say it, people start touching their face actually. So the biggest reason to wear a mask is it keeps you from touching your face because it's the spread from your hand to your face is the biggest risk. The other reason is an inverse thing. It's to stop you from spreading it to everybody else. If you don't have symptoms yet but may already have it, well, if you were to cough and you have a mask on, it'll stop there and not be spread out into the air where you might infect everybody else. One way to think of it is I was told by the Japanese culture, my daughter lives in Japan, one reason they wear a mask isn't because they're protecting themselves, it's more out of politeness. If they have a cold, they don't want to spread it to everybody else, and they have a different way of thinking of it. And so it's partly out of politeness that they wear the mask. It's not out of selfishness. And so the reason you want to wear the mask is to keep yourself from touching your face, but also so when you cough, you don't spread it. So should you wear a mask? I'd say potentially and likely any mask will do. It does not have to be an N95. The most important thing though is to wash your hands anytime you change locations. So if you, let's say you go to the Lincoln Public Schools district office or the grocery store, it's touching contaminated objects like the doorknob, the elevator button, the checkout counter, credit card machine. That's the major risk of spread. And so by washing your hands and wearing a mask, you would hopefully prevent that contamination from happening. And if you have an N95 mask, don't keep it. Please give it to your local clinic or hospital because a lot of them are desperately short on stuff. So simple rules back to the NPIs. If you're sick, stay home. And if someone in your household is sick, stay home. That's probably the single biggest thing, and I wish people would pay more attention to that. We already closed down the schools and daycare. We're also talking about changing it, the name from social distancing to physical distancing. We still want to be social, but make sure you maintain your distance. Probably 6 feet indoors, at least. Outdoors, probably not as big a deal. But maintain your distancing so that people are safe. The key is that exponential spread is that one person making the right decision can have a spread that goes from here to a spread that only goes from here and even less. So if we work from home, if we wash our hands, and I'm mostly worried about people going to the park and having a baseball game or a volleyball game, that is not social distancing people. So going out on a bike ride is fine, but not playing a pickup basketball or having a barbecue. We're all sharing the same stuff. And so I've been asked questions, is this okay? Well, not if this is a common table with a ketchup bottle or a bag of chips, because if you're touching the same stuff, that's how it gets spread. There's almost zero risk of you coughing and spreading it to this person. It's the touching of stuff that's the problem. The other problem is when you do this stuff, are these people all living in the same house? If they don't live in the same house, that violated social distancing right there. And so you need to maintain the distancing and do it right. No contact, no sharing, no touching. Wash your hands, especially when you get home. This is good social distance, physical distancing, but while not having social isolation. I think this type of gathering is fine, and we plan to do this in our neighborhood when it gets nice out. We'll have our own chair, our own cooler, we'll maintain our space, and I think we'll be just fine. The other question people are asking me is, should we do a stay-at-home order? I actually am okay with how Nebraska is doing it right now. I think our spread is low enough. I think we acted soon enough. We closed our schools 3 weeks ago. We started enacting physical distancing measures weeks ago. We went to a no gathering of less than of 10 or more weeks ago. Also, some of these people claim that they have a stay-at-home order are having exceptions like church services, which is a big no-no right now. And so this is a somewhat misleading map. The other thing you have to keep in mind is the geography and where you're at. If this is where you live and this is your commute to work, I don't think this is going to work. You need masks and probably need to shelter at home. This was literally my commute back and forth to work yesterday. I don't think there's any risk whatsoever of me getting coronavirus if this is my commute or if this is my walk in the neighborhood. Whereas if this is my walk in the neighborhood, it's a totally different story. So I do think we do not necessarily need a one-size-fits-all around the country. It's based a little bit based on simple geography. The single biggest thing is if you're 6 feet away from people and washing your hands, your risk of spread is pretty close to zero. So if you can maintain that distance, you're good. So I do actually agree with the governor's news conference and explanation last night. It also makes me very happy to see that we are pulling in our national experts. Last week he had Dr. James Lawler from UNMC, and this last night he had Dr. Ali Khan from the College of Public Health, and Ali is an international infectious disease outbreak specialist. So we're bringing the experts in Nebraska, which makes me very encouraged. And the other reason I don't think we need complete stay-at-home orders is if you can do this, your risk is zero as well. And we need this for our mental health, our physical health. The vitamin D and sunshine is good for you. And so I don't think we need stay at home as long as we can do this and not necessarily have people getting together playing pickup basketball. So hopefully that was helpful to you all, and we'll probably work on another update in another 3 to 4 days.